Hi there, it's Dr. Scott Scher again. It's nice to be back with you on this second episode. Again, my name is Dr. Scott Scher. I am a hyperbaric physician as well as an internal medicine doc. I work very closely with a company called Hyperbaric Medical Solutions as a physician partner, a national medical advisor, as well as head of innovation and protocol development. And on our first episode, we talked a little bit about my background, a little bit about hyperbaric therapy. I thought today we could talk about oxygen carrying capacity. Sounds like big three words, but all that really means is that how much oxygen we can get into circulation at any one time. Now, typically, you hear about people training at high elevations if they're trying to run races because they're trying to increase their oxygen carrying capacity. Oxygen carrying capacity really means how much oxygen we can take in circulation from our lungs as we breathe in and breathe out, no matter where we are, get that oxygen from the air and bring it to our body's circulation and to our muscles and to our organs and everything else. Now, hyperbaric therapy has a very interesting way of getting oxygen into circulation. Typically, this requires the red blood cell. Red blood cells have 4 sites on them that allow oxygen to actually attach, and that oxygen goes into circulation, into our body, into our cells and muscles, etc., releases. It goes back to the lungs, gets oxygenated again, and goes around and around. Now, in a hyperbaric chamber, we actually can bypass this. And the reason why this is so important is that most red blood cells are almost fully saturated with oxygen once they leave the lungs, as long as your lungs are normal. As a result of them being normal, if you had what's called a pulse oximeter on your finger, it would probably rate somewhere between 98 and 99%. And that means that 98 to 99% of those sites are already taken up by oxygen, even in regular air that most of us are breathing right now, which is at sea level. And sea level only has 21% oxygen in it. Now, if you combine a high pressure environment, which is in a hyperbaric chamber, with 100% oxygen, we can actually drive oxygen into the plasma, bypassing the red blood cell itself, getting into circulation and increasing the body's oxygen carrying capacity dramatically. Over 1,200% more oxygen can be circulating. So I often think about Lance Armstrong in this respect. Lance, like many cyclists, were using doping mechanisms to try to increase the number of red blood cells in their body. The longer way to approach that was actually to run at high altitude, because when you run or actually do training at high altitudes where there's less oxygen in the environment, the red blood cells actually get stimulated to produce more of them. Now, in a hyperbaric chamber, we are increasing oxygen carrying capacity almost immediately, as soon as it's saturated in the body. So it would be interesting if somebody took an experiment and decided, well, let's put myself in a hyperbaric chamber and then run my race immediately after. Because that oxygen will stay in the system, the oxygen from the hyperbaric chamber, for about an hour or so, an hour and a half afterwards. So if anybody's up for an experiment, let me know how it goes. But it's not just about oxygen carrying capacity, it's about what our body is going to do with that oxygen when it gets into the cells of the muscle, of the organs, of the brain tissue, no matter where we're going here. And that really just depends on what we're trying to do. If there's an acute injury, having a high oxygen environment will allow tissues that potentially may be at risk to not be at risk anymore, or mitigate the damage that may occur. In the long term, we're actually recreating the scaffolding in the areas of injury. I often say that hyperbaric therapy is a wound healing technology. Anti-aging is wound healing. Wound healing requires mechanisms like hyperbaric therapy to decrease inflammation and recreate cells, regenerate cells that maybe are not functioning well and maybe functioning poorly, and recreating a way for the body to work at maximal and optimal capacity. So oxygen carrying capacity really means how much oxygen we can get into the bloodstream at one time. And in a hyperbaric chamber, we can hyperdrive this. We can accelerate it to levels that are not possible in any other way. 1,200% more oxygen into the body's circulation, having an effect on the DNA itself, changing what proteins are transcribed to allow those that need to be upregulated for growth and decreasing inflammation, and those need to be downregulated or decreased, those that are responsible for inflammation and programmed cell death. So there it is, oxygen carrying capacity in a hyperbaric chamber. Have a great day.